NIHSS Certification Test 2026, National Institute's Health Stroke Scale. All you need to know. Question 1. What is the total possible score range for the NIH Stroke Scale? 0 to 24, 0 to 42, 0 to 15, 0 to 100. The NIHSS total score ranges from 0 to 42, with higher scores indicating greater neurological impairment. Question 2. In Category 1B, log questions, how do you score a patient who is aphasic and does not comprehend? Score 0, score 1, score 2, score UN. Aphasic or stuporous patients who do not comprehend the questions are automatically scored a 2. Question 3. For Category 1C, log commands, what is the score if the patient performs one task correctly? Score 0, score 1, score 2, score 3. Performing one task correctly, e.g. only opening eyes, earns a score of 1. Question 4. How should a patient's arm be positioned for motor drift testing if they are supine? 90 degrees, 30 degrees, 45 degrees, 60 degrees. In the supine position, the arm is held at 45 degrees for 10 seconds to test for drift. Question 5. What score is assigned for partial gaze palsy that can be overcome by the oculocephalic reflex? Score 0, score 1, score 2, score 3. A gaze palsy that is partial or can be overcome by the oculocephalic reflex is scored a 1. Question 6. When testing visual fields, Category 3, what is the score for complete hemianopia? Score 0, score 1, score 2, score 3. Complete hemianopia, loss of half the visual field, is assigned a score of 2. Question 7. In facial palsy, Category 4, how is a flattened nasolabial fold and minor smile asymmetry scored? Score 0, normal, score 1, minor, score 2, partial, score 3, complete. Minor paralysis, such as a flattened nasolabial fold or slight asymmetry when smiling, is scored a 1. Question 8. If a patient's leg falls to the bed before the 5-second count ends but shows some effort against gravity, what is the score? Score 1, score 2, score 3, score 4. A score of 2 is given when the limb drifts to the bed but has some effort against gravity. Question 9. How is limb ataxia, Category 7, scored if it is present in 2 limbs? Score 0, score 1, score 2, score UN. Ataxia is scored 0 if absent, 1 if present in 1 limb, and 2 if present in 2 or more limbs. Question 10. What score is given for mild to moderate sensory loss where the patient feels a pinprick is less sharp on one side? Score 0, score 1, score 2, score 3. Sensory loss where the patient feels the pinprick is less sharp or dull on the affected side is scored a 1. Question 11. In best language, Category 9, what score is given for severe aphasia where the examiner must infer the patient's meaning? Score 0, score 1, score 2, score 3. Severe aphasia, where expressions are fragmentary and the examiner must guess the meaning, is scored a 2. Question 12. How do you score dysarthria, Category 10, for a patient who is intubated or has a physical barrier to speech? Score 0, score 1, score 2, score UN. If the patient is intubated or has another physical barrier to speech, they are scored 0 for dysarthria. Question 13. What is the score for profound hemianattention, where a patient does not recognize their own hand? Score 0, score 1, score 2, score 3. Profound hemianattention or extinction to more than one modality is scored a 2. Question 14. Which NIHSS score range typically indicates a moderate stroke? 0 to 4, 5 to 15, 16 to 20, 21 to 42. Scores between 5 and 15 are generally classified as a moderate stroke. Question 15. When testing motor leg, Category 6, how long must the patient hold their leg at a 30-degree angle? 3 seconds, 5 seconds, 10 seconds, 15 seconds. The leg must be held at 30 degrees for a full 5-second count. Question 16. For Category 1B, log questions, what are the 2 specific questions asked? Name and date, month and age, location and year, president and day. The patient is specifically asked to state the current month and their current age. Question 17. How do you score a patient for motor arm drift if they have had an amputation at the shoulder? Score 0, score 4, score un, score 1. Amputations or joint fusions that prevent testing are scored as untestable. Question 18. During gaze testing, Category 2, what is the examiner specifically assessing? Vertical eye movements, horizontal eye movements, pupillary response, blink reflex. Category 2 of the NIHSS tests only voluntary or reflexive horizontal eye movements. Question 19. True or false? In Category 1B, the examiner may help the patient if they are close to the right answer. True, false. False. The patient must be exactly right and the examiner is not permitted to coach or provide cues. Question 20. In Category 5, motor arm, what score is given if the arm drifts down but does not hit the bed within 10 seconds? Score 0, score 1, score 2, score 3. If the arm drifts during the 10-second count but does not touch the bed or other support, the score is 1.